Hi, Mary. It's nice to meet you. My name is Jaden. I'll be kind of working with you throughout your time with me. So I just want to let you know that this session is really going to be me asking you a lot of questions. It's going to be all about you. It's just to get a good idea of, who you are, your background, what you've been going through. So a couple of the questions are repetitive, some are really basic, some are a little bit more sensitive. So if you ever need a break or you have questions or comments, just let me know and we can always do that. So if it's okay with you, I'd like to get started.
Sounds good.
Perfect. So Mary, tell me, when is your birthday?
June 21st of 2001.
Okay. And so how do you identify as your race or ethnicity?
White.
Okay. And so I know I saw that your psychiatrist Jennifer referred you to me. How long have you been working with Jennifer?
Oh, really? Not that long. Maybe like 2 or 3 months.
Okay. How often do you see her?
Um, I think it's about every other week.
Okay. Okay. And so I would like to understand it from your perspective, but why do you, what kind of probed her referring you to me, in your own opinion?
Yeah. So Jennifer had tried a couple different medications and they just didn't work. So we were thinking about just utilizing other services
Okay.
to kind of hopefully handle the situation, I guess. I don't know.
Okay. And I apologize. I am also taking notes while we discuss this. So, if I'm kind of like off in my own world, I'm just
Yeah,
taking what we've been talking about.
no worries.
Um, so with that medication troubles, what was kind of the initial start of starting those medications? What kind of problems, in your own opinion, have you been experiencing that kind of caused you to see Jen as well as taking medications?
Yeah. I really just haven't been feeling well or like myself at all. Um, it's been a while. I don't know. I can't remember. Probably like a few months, and I I don't feel hopeful. I don't feel like doing anything I normally like doing. Um, I'm tired all the time. Like I don't feel like myself.
Okay. Have you been having any trouble sleeping?
Yeah. Yeah.
Okay.
I don't sleep well. I maybe 4 or 5 hours,
Okay,
but I'm
that's
tired all the time.
so fatigue. Okay. Okay, that's good to know. Those are hard symptoms to be experiencing. Um, have you had any of these same symptoms in the past? Is it kind of gotten worse recently, or how do you feel about your symptoms?
I mean, I've had these symptoms in the past, but nothing to this extent at all. Like maybe a week or a day where I felt like I didn't want to do anything, or like the sleep. I don't normally sleep well, but it's just been worse lately. Um, I don't know. I wouldn't say it's like consistently been a problem.
Okay. And when did, not these present symptoms, but just the symptoms in general, when did those kind of start occurring?
Um, Maybe a couple years ago. I don't really remember. I'm sorry.
Oh, that's totally fine. I just like to ask to see if I could get a general, and that's a
Mhm.
perfect answer. So thank you. Um, okay. Do you have any, a little bit more sensitive, do you have any current or past history of any suicidality, any suicide attempts or suicide feelings wanting to?
I mean, not really. I do have days where I think it'd be so much easier if I was dead, or um, nobody would even care if I died. But like those thoughts don't last super long, and I don't have like any plan. They're just kind of thoughts I have sometimes.
And have you had any, aggression or any thoughts of hurting anyone?
No.
Have you, experienced any, hallucinations or delusions, things that aren't really there?
No.
Okay. And I know you see Jen. We talked about how you've been seeing her for a couple of months. Are you on any medications currently?
Right now, I'm on an antidepressant.
Okay. Do you feel like that medication has been, oh, we talked about, no, it's been troubles, like, were they working at first or had they just been,
I don't really feel like they've ever worked. Yeah.
okay. And that happens. Have you ever been in an inpatient facility, any mental health hospital? Okay.
Nope.
Okay. And so I know you said you don't have any current or past suicidal ideate, any suicidal, so no suicidal attempts, no, like, okay. Okay. In your family, if you can think of anyone or maybe no one, but does anyone have any history of mental illness in your family?
I don't really think so. I don't know. We don't really talk about that type of thing in my family.
Any substance misuse?
Nope.
Any significant trauma that kind of stands out to you within either yourself or your family?
Um, I mean, not really. I don't know.
Do you personally use any substances like alcohol or marijuana, methamphetamines?
I mean, I'll occasionally like drink with friends and family, like, but it's no more than a couple of times a month.
Okay, no, not like a problem that you find yourself identifying. Okay.
No.
Okay. Do you have any siblings?
I have two siblings.
Okay. Are you married? Have been married in the past?
I'm married. Yeah.
Do you have any children?
No,
Okay. And these questions are kind of basic, so I apologize if they're little.
that's okay.
What is your current education or highest level of education completed?
I have a bachelor's degree.
Are you currently employed?
Yes.
Where do you work?
I just work for a marketing agency.
Okay. Any military service?
No.
Any stressors within the family? Any recently big stressors like any divorce, losses?
Um, I mean, n- nothing too terrible, no. Just kind of frequent, normal stuff, I guess.
Okay. Do you have any current like medical conditions or issues that you're okay?
Nope,
Any um non-psychiatric hospitalizations?
nope,
Okay. Any allergies?
nope.
Okay, well, Mary, based on, what you've been kind of presenting to me regarding your symptoms of hopelessness, losing interest in certain things that you've been doing, just not feeling like yourself. It does seem to me that you're experiencing some symptoms of depression. There's various kinds. So that's what you and I would be working on together is to hopefully get a correct diagnosis for you. And so in that way, we can help hopefully figure out a plan together to kind of combat that depression and those symptoms that you're experiencing, either with medications or with certain coping skills or therapies that we could use. Um, I'm thinking, and you can always put your input into this, but I'm thinking that we maybe start therapy sessions. Would you rather start once or twice a week?
Um, could we start out once a week? Just because I think it could be hard to work around my work schedule.
Of course, yeah. And so obviously, I want it to be collaborative of you and me. So once a week is great. I think this was a great initial first session with us. You gave me so much information that I really appreciate. And so within our next sessions, we will just be, going through some more of these types of some more of this information, kind of diving deeper into that. And hopefully down the road, we can make a diagnosis for you and get you on a treatment plan that will help alleviate your symptoms and get you going to what you want to work on. So, do you have any comments, issues, or concerns for me? Okay, perfect. Well, let's plan for the next session to be next Wednesday. How does that sound for you?
That sounds good.
Okay, perfect. Well, thank you for coming in today, Mary. I really appreciate it.
Thanks.